So the original objective for the Pinnacle Registry was to bring the American College of Cardiology performance measures and benchmarking services into the outpatient space. My name is Nathan Glusenkamp. I'm the Director of Outpatient Registries at the American College of Cardiology. The American College of Cardiology has operated the National Cardiovascular Data Registry for many years. Those incidents collected in that registry, those databases, were based around individual bundles of acute care in the hospital setting. So our original vision was most chronic disease management takes place in the outpatient setting. These are where a lot of our patients are. These are where a lot of our members are. We need to extend the data collection, the benchmarking, the research services into the outpatient space. What FigMD allowed us to do was to harness a lot of the emerging promise of electronic health records in order to extract data from multiple different electronic health record systems that are being collected natively in the course of that face-to-face office visit. So it's reduced or eliminated the data collection burden for individual providers. It's allowed us to get good data at scale from a variety of different electronic health record systems, a variety of different care settings, and it's enabled us to do the benchmarking, provide the performance reports back to the individual providers in a way that we simply couldn't do via any other mechanism. What FigMD has allowed us to do is embrace the ethic of saying yes. I think they're a company that says yes, and they've been a company that has allowed us to say yes. We can work in your system, we can work with your system, as long as we can have access to the database or even files pushed to us from the EHR system. FigMD can help us parse, interpret, and make sense of the data that are already being collected in those systems. So it's allowed us to work with several dozen different EHR systems, derive data from them, and that provides a much more truly representative national sample in our registry. It's beneficial for benchmarking, and it's beneficial for the research that we're doing. You can imagine the biases if we were trying to conduct peer-reviewed research out of only one EHR system, or even 5 EHR systems. Instead, we're able to work across dozens. We can say yes to our members when they want to transmit data to us, and as I said, we have a truly representative national repository of cardiovascular patients as a result. FigMD's technology helps the practices harness the promise of their electronic health records. It allows them to get meaningful information out of those records and to benchmark themselves against peers across the country. You can imagine if you're a provider all day long entering data into an electronic health record, but you never see a lot of meaningful outputs from that. You don't have a good aggregation of how you're doing for certain patients. You don't have drill down capabilities into those patients for whom you may not have taken a recommended quality action. FigMD's technology via the Pinnacle Registry helps practices do that. And it's easy. And you can see how if something is easy to do and helps you harness the power of a system that you've already installed, why that would be very attractive to a wide range of participants. I think about the iPod or many other devices that we all now carry around in our pockets. I didn't know I needed that until I had it. And I think about that frequently with FigMD, the new technology solutions that they offer to us. I didn't know I needed them until we had them. And then they become indispensable to our operations. They're a company that says yes, they're a forward-looking company, and they're a company with which we have a long-term partnership.